Hello everyone and welcome. My name is Taja Vivens, Carondelet Health Network's Communications Manager. February is American Heart Month and we at Carondelet would like to help you learn how to recognize the warning signs and symptoms of heart attacks with a little help from our emergency medical services partners. Today I'm joined by Rincon Valley Fire paramedic Travis Mooney. So Travis, thank you for being here with us today. Can you tell us a little bit about yourself and your role as a paramedic?
I've been a paramedic for 5 years. Before that, in EMT since 2009. 11 of those years with Rincon Valley Fire here. I'm married with 2 boys, and typically I'm on an ambulance and running on the ALS medical calls.
So, first official question for you. On average, how often do you and your teams respond to heart attack calls in the community, let's say, within a month?
At least a couple times a month. It's not the most common, but it does happen somewhat frequently.
What are some of the common risk factors that might lead someone to have a heart attack?
So, according to the American Heart Association, some of the modifiable risk factors are like tobacco use, diabetes, high blood pressure, high cholesterol, sedentary lifestyle. Some of the non-modifiables is increasing age, the male gender, and heredity. So genetics.
And so for those who are experiencing a heart attack, what do those symptoms look like? What are the signs? And they're different in women, correct?
So women, yeah, it's different between men and women, but the most telltale sign would be chest discomfort. So a pressure or pain in the chest can radiate to your arms, one or both arms. It can radiate to your neck, jaw, your back. You can also have shortness of breath, nausea, vomiting, lightheadedness. There's a lot of smaller symptoms, but the most common is the chest discomfort.
Okay, but that's true. There are a lot of smaller symptoms going on there. So when someone is experiencing that, what should they do? I'm assuming, of course, call 911.
Yeah, absolutely. Call 911. Stay calm. Try your best to relax. You want to take that stress off of the heart. The best thing you can do is stay calm. If you're prescribed some medications for chest pain like nitroglycerin, you can take that. Aspirin, baby aspirin, but when the paramedics arrive, we have that stuff in our drug box and we'll administer that when we get there.
Now, as a bystander calling 911, what information do they need to tell the dispatcher?
So most importantly is going to be the patient's location, so the address or the business that they're located. Next, they'll just need the patient's age, gender, the signs and symptoms that they're experiencing, and if they've ever had this happen before, or what their past medical history is.
When first responders approach a heart attack call, what are the steps that you guys go through with a patient experiencing a heart attack?
First and foremost, we're going to introduce ourselves and ask the patient what's going on, why they called 911, what they're experiencing, how they're feeling. So based on those symptoms, then we're going to start with vital signs, and if we're thinking chest pain, heart attacks, once we do the EKG, then that kind of helps guide our treatment from there.
And what are the steps that you guys go through as far as figuring out where to transport a patient?
So for heart attacks specifically, places like St. Joe's, they have a cardiac cath lab, so any hospital with a cardiac cath lab or that can be a cardiac care receiving facility, we would take them to that place.
Is there anything else that you wanted to add?
Talk to your doctor, make sure you understand the signs and symptoms, and just remember to remain calm.
Well, thanks again, Travis, for taking the time to break down the signs and symptoms for us. And thank you for watching this special Carondelet Heart Month video.